Good morning, everyone. Good morning. I'm sorry, it's 1 o'clock. Good afternoon. So we're just gonna wait a little bit and let some more people join us before we go ahead and get started with today's webinar. But I just want to say welcome to all of you who are already in the room. And if you don't mind, you can go ahead and put where you're from in the chat, then we would really appreciate it. And so I am up here in Bossier City, Louisiana, where it is sunny and it is warm. But tomorrow they say the weather is going to change. So we are just waiting for that fall weather to finally come in. Okay, well, I think we can go ahead and get started with this afternoon's webinar. So again, I want to thank you and welcome you guys for coming to our webinar today. My name is Chanel Jackson, and I'm the Executive Director of Family Step and Families Region 7, and we are located in Northwest Louisiana. Family Step and Families Region 7 is one of 10 Family Step and Families networks throughout the state. We provide information and referral, training, and peer-to-peer support to individuals with disabilities and their families. And I want to welcome you to our webinar today on Act 421, TEFRA, which is a Medicaid option. And I have the privilege of having these two lovely ladies with me, Janice and Brandy, and they are from the Louisiana Department of Health. And they're going to tell us all about the program, how to get enrolled, what the program details. So I know this is going to be a lot of good information for our families. So ladies, I'm going to go ahead and let you get started. If you have any questions, please wait until the end. We will do a Q&A at the end for all questions. So Janice, I'm turning it over to you.
Thank you. Thank you so much, Chanel. Again, my name is Janice Lewis. I am the program manager for Act 421 Children's Medicaid Options Program. We're located here in Baton Rouge, and we're excited to be here today. I do have Brandy Croft. I'll let her say something, who also works this program with me.
Hello, good afternoon. I'm Brandy Croft. I'm the program monitor for the Act 421 Children's Medicaid option here in Baton Rouge. Glad to have you.
Okay. Today, we're just planning to do an overview of Act 421. So what is Act 421 TEFRA? Louisiana Act 421 Children's Medicaid Option is a program through Louisiana Department of Health that allows certain children with significant disabilities to receive Medicaid coverage, even if their parents earn too much money to qualify for Medicaid. Louisiana's program is modeled after the Federal Tax Equity and Financial Responsibility Act. That's where the TEFRA name comes from. And the goal for this program is to keep children with significant disabilities in the community with their families instead of being institutionalized. The word disability here refers to having a physical, mental, or emotional health condition that causes limitations in activities such as bathing, dressing, daily chores, just to name a few. Act 421 Children's Medicaid option uses the Social Security Administration's definition for disability. The child must have a disability that is recognized under the definition of disability that is utilized in the Supplemental Security Income, also known as SSI, program of Social Security Administration, regardless of whether the child is eligible to receive benefits under that program. So for children who do not have a disability determination by the Social Security Administration, the Medicaid Eligibility Determination Team, which we call MEDT, will make that disability determination. To qualify, children must have a disability that is recognized by Social Security. SSA benefits. And they must meet Medicaid eligibility and institutional level of care requirements. And we're going to talk about all of that as we go forward. The applicant must be a resident of Louisiana, must be a citizen, U.S. citizen, or qualified non-citizen, have a social security number or have applied for one, and the cost of care must be provided safely in the home for less than the cost of being in an institution. Eligibility for Act 421 Children's Medicaid or TEFRA will be renewed annually per federal requirements. A notice will be sent out by Medicaid when it's time to renew your Act 421. Some other requirements are that only applicants who are determined ineligible for other Medicaid programs, for example, premium-based Medicaid programs, will be considered for Act 421 Children's Medicaid option. The applicant must be under 19 with disabilities and meet institutional level of care requirements. Applicants are not required to show that they are or have been institutionalized, but instead that they meet level of care criteria. And we're going to talk about a little bit about that level of care criteria, what that is. Applicants who, in this case, refer to the child must not have assets exceeding $2,000 in value. And this does exclude the assets of the parent. Applicants who meet financial and categorical eligibility requirements will be enrolled in Act 421 CMO program. For questions about enrollment, you can call Medicaid at the 1-800-230-0690, where there is Medicaid eligibility staff to assist you. Next, we're going to talk about how to apply for Act 421 TEFRA. There are several ways to apply for Act 421 or TEFRA. First and foremost, applicants must complete a Medicaid application either online, by phone, mail, or in person. They can apply online at www.healthy.la.gov. They can call the toll-free number at 1-888-342-6207. You can also complete a paper application and mail it into P.O. Box 91283, and that's in Baton Rouge, Louisiana. Or you can apply in person at the nearest certified Medicaid center or at one of the Medicaid regional office. It's important to know that at this stage in the juncture, you also have to select a health plan. Otherwise, there would be one selected at random for you. Level of care packets that's sent to applicants. Medicaid mails a level of care packet with forms to families who meet criteria for Act 421 TEFRA. Forms will need to be completed and returned to Medicaid before moving to the next step in the process. Assuming all appropriate documentation is returned back to Medicaid, the next step is that Medicaid sends notifications to the applicant's local governing entity to start a level of care assessment. Also, there is no waiting list or cap on the number of people that can be enrolled in Act 421. Again, if the applicant does not meet the criteria for any other Medicaid programs and marks yes on the question referring to having a disability on the application, then this triggers the system to note that the child is possibly eligible for Act 421 TEFRA. I'm going to say that again. If the applicant does not meet the criteria for any other Medicaid program and marks yes on the question referring to having a disability on the application, then this triggers the system to note that the child is possibly eligible for Act 421 TEFRA. And talk about level of care packets. Once you submit your application, LDH, Louisiana Department of Health, will mail out appropriate packets to Act 421 applicants depending on their SOA status or statement of approval status. Those with the statement of approval or has early steps eligibility receives the 9EL. Those without an SOA receive a health records request form. When documents are returned to LDH, Act 421 staff will ensure that the packet is complete. If the packet is not complete, LDH staff will reach out to the family, to the parents to obtain that missing information. After level of care packet is received, assuming that all documents are returned to Medicaid, the next step is that Medicaid sends notification to the local governing entity to start the level of care assessment process. Now we're going to talk about enrollment. There are 4 general steps to enrolling in Act 421. First, the Medicaid application is completed. Second, a level of care assessment is done by the local governing entity or LGE. And if approved, you then move to the third step, and that's to have a disability determination, which we call MEDT, for those applicants that do not have a disability determination already from Social Security. And lastly, if approved to this point, from steps 1 to 3, there is step 4, enrollment and service coverage through a healthy Louisiana plan. Currently, I believe there are 6 plans that is offered through Healthy Louisiana. More about enrollment. If the level of care assessment done by the LGE is approved, as mentioned earlier, a disability determination will be made by MEDT, that's Medicaid Eligibility Determination Team, unless the applicant already has a disability determined by Social Security Administration. If the level of care is not approved by the LGE, the process stops and the application or the applicant is not eligible for the program. However, if an applicant is denied for any reason, they have the right to a fair hearing through the appeals process. And we'll talk a little bit more about the appeals process later on in this PowerPoint. Applicants who, again, meet financial and categorical eligibility requirements will be enrolled in Act 421. And the participants will receive all Medicaid state service and benefits as any other group. Next, we're going to talk about level of care assessment. And my colleague Brandy, she's going to pick up, and I'm going to stop sharing my screen and let her pick up.
Let's see here. I think I'm on the wrong one. There we go. Okay. As Janice mentioned, the next part of the process would be for the local governing entity to complete the level of care. And there are 3 level of care pathways. We have the intermediate care facility, hospital level of care, and nursing facility level of care. So again, I wanted to mention that the applicants are not required to show that they are or have been institutionalized, but must show that they meet the criteria for institutionalization through one of these pathways. And I'm going to give more information about each individual pathway in just a moment. But okay, so we'll start with the intermediate care facility level of care pathway. To be considered for this particular pathway, the child must have a statement of approval through the regional office under the Office for Citizens with Developmental Disabilities. That's your local governing entity that Janice has mentioned several times. So either the child would have to have a statement of approval issued by that regional office, or they must be eligible for the Early Steps program. And I'll tell you a little bit more about both of those in just a moment. But also, to be considered for this level of care pathway, once the child has been determined to have developmental disability eligibility through the Statement of Approval Early Steps program, then they must get their physician or physician assistant or nurse practitioner to complete the Form 90L, which is the request for medical eligibility determination. And that is in that packet that Janice mentioned. Okay, for the Early Steps program that I mentioned, this is a program that's for children birth to 3 years of age who have a medical condition that may result in a developmental delay or have a developmental delay that's already been identified. And so the child may apply for this particular program for up to 45 days before their 3rd birthday through their regional office or a single point of entry. And then the OCDD statement of approval, as I mentioned, this would be issued through your regional office or local governing entity. There's a process that they must go through there where their entry staff would meet with the person, the child and their parent in the situation, and provide some documentation that would be reviewed by the staff there, meet the child in person, possibly complete some assessments, and then they would make that determination as to whether the child has a developmental disability. And so a developmental disability is a severe chronic disability that attributes to the physical, intellectual or physical impairment. And this, it would have to be identified before the age of 22 years. So the developmental disability, the disability would have to have occurred before age 22. That the child may be born with this disability or something identified later on, but it would have had to have occurred before the age of 22 for the person to be eligible for a statement of approval. And the disability cannot be primarily attributed to a mental health or behavioral health condition alone. So if they meet the definition of having a developmental disability per our OCDD policy, then that statement of approval is issued. And children that are 2 years, 6 months and older may apply for OCDD services. Those children who are in the Early Steps program, when they reach 2 years, 6 months, then the Early Steps staff would, ask the parent if they are interested in applying for OCDD services for their child, and they would refer that child over to that regional office to complete that disability determination process through that regional office, their entry unit, if that developmental disability is suspected. Right, so the Early Steps process takes about 45 days from intake to making that determination and completing that plan for the child and getting that in place. So that's part of the reason why they only accept children up to 45 days before their 3rd birthday. Let's see. Okay. We just wanted to give an example of the Form 90L that is completed. This is the request for medical eligibility determination form. This is the form that's sent in the packet for those children who have been determined to have a developmental disability. This one has been filled out pretty well. The parent is to complete the first section, which is the applicant information. They fill out the child's information, the parent information, and then the parent would sign and date on line G. The next section, the level of care, which is section 2, all of that, from that point on, the medical staff would complete the form. This first box there is one of the main sections that is required for the form to be considered complete. For this particular program, if that medical staff feels that the intermediate care facility level of care is appropriate for the child, then they would mark the ICF IID level of care. And as I said, that is the most appropriate for this particular program. The next section, medical information, that's section 3, they would need to include the diagnosis of the child, medications, if any, and then on that second page or the backside of the form, they would continue to fill that out, indicating what assistance they require with the daily living task, whether they're able to do it independently, which is self, if they require some assistance or total assistance with bathing, eating, personal hygiene, mobility, ambulation, and those things. And then at the bottom, the very last box, the bottom of the page, that is where the physician is to be identified. The physician may complete the form and sign, or if the physician assistant or nurse practitioner is, if they're completing the form, they may sign the form. They would need to print their name, sign it, and date it, but they do have to identify the physician that's overseeing them. So those are the main parts of the form that are required for the form to be complete. So once it's returned back to Medicaid, they would review the form to make sure that these sections are complete before they would notify the local governing entity that a level of care is needed for that child. If the child does not have a developmental disability identified already, does not have a statement of approval, or has not been determined eligible for early steps, the packet, as Janice mentioned before, the health record request form would be sent to the children who do not have the statement of approval or early steps eligibility. And so once that is completed and returned to Medicaid, Medicaid reviews that and then notifies the local governing entity that the child's ready for review. The local governing entity staff will see this information. If they suspect that the child has a developmental disability and would be appropriate to refer to their entry unit or to the early steps program, they would get permission from the parent to go ahead and make that referral. And if the child is determined to have a developmental disability, then they at the local governing entity will provide that Form 90L to the parent, so they may take it to their physician to get it completed. Once it's returned to the staff there at the LGE, then the staff will review the form to make sure that it is complete, all these sections that I've mentioned here. And then if it's not complete, then the LGE would address it with the parent or with the provider who completed the form. Once it's complete, they will review the information and then proceed with the process. This is a new form that we've recently included in the packet, or Medicaid has added to the packet, the Form 90L checklist for Act 421 CMO. We were getting kind of a high volume of forms returned that were not completed correctly, or there was missing information. So we put together this form to send out in that packet to try to help the parents, be more aware of the items that they need to complete and what the physician or other medical staff needs to complete. And then they may take a final review of it before they return it. So that's just to help move things along more smoothly, and we won't have the back and forth. If it's returned to Medicaid and they find an error, it's incomplete and missing sections, then they would address it. But if the LGE has provided the form and they see something missing, then they would address it with the parent or the provider, the physician or physician assistant, nurse practitioner. So. All right, so the next level of care is the hospital level of care. And this assessment is completed by the nurse, a registered nurse, at the local governing entity. They have a specific assessment tool that they use to determine if the child meets this particular level of care pathway. And so the nurse will review information provided by the parent. This would be documentation, records from a licensed professional. So they review these documents and interview the parent and possibly providers if needed with the parent's permission. And so the assessment must show the frequent medical care that requires the use of equipment to prevent the life-threatening situations with skilled medical care required more than once during a 24-hour period. Also, skilled medical interventions that are expected they must be expected to last at least 6 months. And then also the health condition, it requires that the health condition is unstable, presenting constant potential for complications or rapid deterioration, such that the child requires monitoring in order to detect unstable or life-threatening conditions and respond with appropriate care. Next, we have the nursing facility level of care. And here again, the registered nurse at the local governing entity is required to complete this assessment. There's another specific tool that is used, that the nurse uses to complete the assessment for this level of care pathway. Here again, they review the records, the documentation that is provided by the licensed professional specific to that licensed professional must be specialized in that area, in such as for autism, for an autism diagnosis. A psychologist would complete that evaluation to be able to make that determination for that diagnosis. So they must be specialized in that particular field. So the assessment for the nursing facility level of care, the child, it must show that the child has a diagnosis of a medical or physical condition resulting in needs requiring long-term care services of at least 6 months. And the child requires skilled nursing interventions and or has substantial functional limitations requiring hands-on assistance from others throughout the day. So the nursing facility level of care, there's actually 3 parts to that tool, and that the child may have a condition such as cancer or post-transplant. If they meet one of these severe conditions, then they may meet the nursing facility level of care. Also, they may meet the level of care by having 2 substantial functional limitations, such as in learning and communication, or say learning and self-care, which is bathing, grooming, dressing. If they require a certain amount of assistance in those areas, then they may meet the nursing facility level of care. Or if they have limitations in 4 areas of the substantial functional limitations, they may meet. The skilled nursing interventions, there's a certain list of interventions that the nurse does take into consideration to meet this level of care. So once the staff at the local governing entity makes their determination and the child meets one of the level of care pathways, then they would send a letter to the parent notifying them of that decision. And they also notify Medicaid of their decision. So once they make that determination, then Medicaid proceeds on to the next step of the process, which is the MEDT, or Medicaid's eligibility determination team. They would proceed with reviewing the child's information, their records, to see if they meet the Social Security Administration's definition of disability. If the child does not meet one of the 3 level of care pathways, they would contact the parent by phone and send them a letter informing them of the decision that they did not meet the level, one of the 3 level of care pathways, so they would receive that denial letter. And the process for the Act 421 Children's Medicaid option would stop at this point. But Medicaid would proceed on with checking to see if the child meets any other program before making that final determination as to whether they are approved or denied for coverage. Regardless of which pathway the child meets, if they are approved by Medicaid, then they have the same plan options as and coverage as anyone else. So there's no specific coverage plans for Act 421. They all have that same opportunity or choice of plans. So Janice mentioned appeals earlier, and so there's several possible things or decisions that may be appealed. If the local governing entity makes the decision or determination that the child does not meet one of the level of care pathways and denies, they issue a denial, then the parent may appeal that decision. If the child does meet a level of care pathway and they notify Medicaid of this decision, but their MEDT team makes a determination that the child does not meet the Social Security Administration's definition of disability and they issue a denial, then the parent may appeal this decision. If they are approved for Medicaid coverage but are denied prior authorization for services, the parent may appeal that decision as well. So it depends on at which level the process or who makes the decision of the denial. You would receive a letter at that part of the process, and it would provide the instructions on how to appeal, who to contact, and how to go about appealing. And if the local governing entity is the one who issued the denial, you can always request assistance from them as far as working through that appeal process. And is my understanding that you may also contact Medicaid if you needed assistance or needed to discuss the appeal with them if they have denied coverage or a service. So we just added in a few common misconceptions that we have learned of or heard of over the past couple of years now. So the first one, my child already has Medicaid, so I don't need to go through the Act 421 level of care process or MEDT eligibility process. So sometimes a child may already be covered through one of Medicaid's other programs, but when it comes up for renewal, their system does some checks, and they may see that the child may be more appropriate for the Act 421 program. So they would need to complete the Act 421 level of care process before moving on. Also, each year, so if the child does meet the TEFRA or the Act 421 TEFRA criteria and they're approved, the next year the child may be considered for one of Medicaid's other programs. So they kind of move from one program to another. It's part of Medicaid's system that we've been informed, that their system's constantly checking to see which program under Medicaid is most appropriate for the child. And that's going to be based on the information that the parent has submitted, whether it be their income or assets, the child assets, and information on the child as far as medical records and those types of things. So the next one is, I do not have to provide records such as medical records, IEP, therapy records, support documentation. This is totally the LGE's responsibility. You will receive, so the parent will receive a form authorizing Medicaid to obtain records from providers such as doctors, therapists, the school, various providers. So, and they will try to obtain records. The local governing entity will try to get records if they do not already have what they need to proceed with the level of care process. They do not always get those very easily. As far as they will try to make contact with those providers to request them, but they don't always get a very quick response. So it's always helpful for the parent to reach out to those providers, make contact with the school, various ones to try to obtain those records. So they can make the most appropriate determination.
And I just wanted to add, sometimes parents may have access to things like MyChart, where they can download certain tests and provide those records to the nurse more quickly than her or him going through that request process. And so what we and sometimes parents, depending on their child's disabilities, may have current records already kept at home for their child because their child is in active treatment. And so we try to encourage the parents to, as many records as you have within the last 2 years, and sometimes even if they're older than 2 years, 3 years, if your child has been active for 3 years in some sort of treatment, that third year we can serve as a background, but for the level of care assessment, the nurse will look at records for the last 12 months, and MEDT will look at more extensively and go back for 2 years. So it's important to try and get those records or assist the LGE in getting those records as quickly as possible. And just to, one more thing on number one, I want to say that some children may be at risk for losing Medicaid. And we see this often where parent is in another program, but is at risk of losing coverage. And so they start to pin for Act 421. And the parent is under the impression that, oh, I don't have to do this because I'm already enrolled. And so if a person pins for Act 421, the parent does need to follow that process and have that level of care completed because of a possible risk of losing current Medicaid coverage in the program that they already may be in. For number 3, my Medicaid application will remain open for as long as I need it to before sending back all my necessary forms. Medicaid is on a time frame when it comes to returning applications. The application will not remain open for an extended time. They will reach out to you, as we stated earlier, for missing documents or incomplete documents that need to be resubmitted or what have you. But after a certain period, if they're unable to reach you, or if those documents are not returned in a timely manner back to Medicaid, they will close your case for failure to provide that information. And so if they close your case for that reason, then you have to just start the process over. Number 4, my child has autism, so he or she will automatically qualify for Act 421 children's Medicaid option. That's not necessarily true. We've heard in the past of folks telling us that with certain diagnoses, they've been told in the community that their child would automatically qualify for this program. That is not at all true. The assessment has to be done. And we've seen, especially with older children with autism, they may not qualify depending on the limitations, depending on the delays. So it just
She's having some technical difficulties there. Yeah, so there are no diagnoses or conditions that that automatically qualify the child for the Act 421 TEFRA program. As Janice was saying, the level of care will have to be completed for all children, whether it be the ICF, intermediate care facility level of care, review, the nursing facility level of care, or the hospital level of care. So the 5th one, if I do not go through the annual renewal process, my Medicaid benefits will continue. For the annual renewals, the parent will actually receive 2 different packets or 2 different a renewal letter from Medicaid that they will have to update their application. So that's one part, and it's going to be separate from the Act 421 level of care packet for the renewal. Both of those have to be completed before the local governing entity can complete the renewal process and for the child to continue their coverage. Also with that, so even once the local governing entity completes the annual renewal process, it goes back over to Medicaid once again. So once they've made their decision, if the child has been approved for one of the 3 level of care pathways, they will notify Medicaid, and they may have to review the child's records again. So the MEDT may have to complete their process again. They may issue an approval anywhere from 1 to 5 years. So there is a possibility that the child's renewal, whether it be the 1st year, the 3rd or 5th, they may have to go back through that MEDT process for them to continue the approval for the coverage. But the parents do need to be sure to complete the, once not notified of the renewal, complete that Medicaid application renewal, and if they receive the packet for the Act 421 level of care, those documents, then they would need to complete those also before continuing with that process. No. Goodness. Janice's computer completely went out on her, completely blanked out on her. So let's see if we can. Let's see here. This now, I'm sorry about that, everyone. Let's see. Okay. Here's our information, the references for the information. There is on the Medicaid website, there is information about the Act 421 program. There's frequently asked questions. There's quick sheets, I think so. There's quite a lot of information on Medicaid's website, but this is the link that should take you straight to the Act 421 information. All right. Let's see. I see we have a couple of questions or a couple of items in the chat. Okay, so when completing the renewal, is there a special application for Act 421 or just complete the regular Medicaid renewal? Okay, and that's what I was just mentioning a few minutes ago. So from what I have seen and what I understand, Medicaid will send out when the letter notifying the family, the parent that of the person's renewal is required. So they will either go online and update their application, or by phone, or by paper, whichever method is works best for the person, the family. And they would have to complete that. And then also, if Medicaid sends out that Act 421 packet to them again, whether it's to complete the Form 90L, get that completed by that provider, or if they do not have a developmental disability determination already with the statement of approval or early steps eligibility, then they would receive that health record request form that would need to be completed and returned back to Medicaid. So both pieces are required for them to move forward in the process whenever the person is up for renewal.
And then I see the question, will there be a way to rewatch this webinar? Yes, this webinar will be loaded to our YouTube channel later today. So you will get an email from us at Family Accepting Families. And in that email, it will have the link where you can actually go back and rewatch the webinar.
Oh, there's one thing I wanted to add to that I just thought it was so when a person is wanting to try to be considered for the Act 421 program, they're going to complete an application, a Medicaid application, just like everyone else. So there's no specific application for Act 421. And there's no place on the application, on the regular Medicaid application, that asks, if they're wanting to apply specifically for the program. So we do get that question a lot. How to apply? I just want to be considered, or want my child to be considered for the Act 421 TEFRA program. What do I do? You just complete that regular Medicaid application. Medicaid is going to, review that information, or their system is going to look at all the information in the application. The parent will be, they'll be sent a request for additional information, such as bank information. All of that will be reviewed, just like it would for some of the, for the other programs. And the parent will have to go through all those steps before the child would end or be considered for TEFRA. So, I have seen where the parent chose not to submit the financial information, and has notified Medicaid that, that they are sure that they would not meet the the requirements for some of the other programs, and that they are trying to um, uh, apply specifically for the Act 421 CMO. And you know, I've seen where they've allowed them to skip that step. I don't know if that's something that happens often, but that's just something that the parent would need to talk with Medicaid about, because they do go through the steps as they would with any other Medicaid application. And once they see that the parent's income is above the amounts for those other programs, and then they see that the question asking if the child requires assistance throughout the day due to mental, physical, or behavioral condition, intellectual. Okay, so they're going to then the child would pin for TEFRA, Act 421 TEFRA.
All right, so if you have any questions, we do have a small group, so I can unmute you if you raise your hand. So if you have any questions, you can just raise your hand and I'll unmute you. And that was gonna be my question, Brandy and Janice. What would you tell a parent who says, well, I'm not gonna try for a TEFRA because even though my child has this significant disability, I know that I don't meet the income requirement. So what would you tell that parent?
Well, it's not based on, for Act 421, they really look at the child's assets, not the parents. And so I would focus in on that it really matters. That's what we talked about early part of the presentation, was that $2,000 limit and all of that, where it really looks at the child's income for Act 421, not the parent. But they may, as Brandy said, have to go through that regular Medicaid process, and they may ask for income information. But when they pin for TEFRA, they're going to look specifically at the child's income and assets.
Yeah, and I think that's where a child who has maybe a trust of some sort, they're going to look at that, is it set up appropriately, in a special needs trust, or if they're have income some kind of way that would put them over that 2,000, that's what they're going to look at for the child.
Well, I don't see any more questions and I don't see any hands raised. So ladies, if you just want to share your information.
All right. We can get this PowerPoint sent to you. But this is our information on how to contact us. There's our address and these are our direct lines. For the office number there, that's our direct office number, and then our email addresses. And
All right.
at any time, you're welcome to contact us, and we'll be glad to answer questions, or try to provide some assistance, guidance, or point you in a direction to try to get some assistance.
Well, I want to thank you ladies for coming on this afternoon and giving us this valuable information, this good information. We did get a comment in the chat that said really good information, and I definitely have to agree with that. Everyone that's on, just don't forget to fill out your evaluation. It's going to pop up when this webinar ends. Everyone completing the evaluation will receive a copy of this PowerPoint because they're going to email it to me. So I'll be sure to send that on to you guys. You'll also get the link to the recording that's going to be on YouTube and a certificate of attendance. And so again, I just want to thank you guys for doing this presentation, and I hope everyone enjoys the remaining of their day.
Thank you for having us, and we really enjoyed it. And yeah, anything else we can do to get the word out about our program, we're glad to do it.
I'll definitely be contacting you. So just look, Janice, you put it out there, so I got to contact you now. Well,
Yeah.
thank you, ladies, and enjoy the rest of your day.
Bye.
Thank you
Okay,
so much.
bye-bye.
Thank you. Bye-bye.